What's worthwhile? Healing mind, body, and spirit. I'm Ramsey Zimmerman. I choose peace of mind, vitality of body, and joy of spirit over stress, exhaustion, or overwhelm. Together, let's explore and pursue the many ways to build holistic health and wellness.
Food has a profound effect on what is going on in your body. So my process is mostly subtractive than additive. I'm looking to eliminate certain things that you have a problem with. And people are different. There's no one size fits all when it comes to fixing this. The issue is to do some detective work and find out exactly what the hidden root cause is. It's a little bit complicated because there's no one diet that serves everybody the same. One person may benefit from a Mediterranean diet, whereas a different person may benefit from a ketogenic diet or a carnivore diet or an autoimmune paleo diet. Food is one thing. It could be caused from liver toxicity. It could be caused from chronic inflammation and oxidative stress. We have to systematically test for this stuff, and then they're going to feel better.
Hey there, it's Ramsey here. That was Dr. Kevin Smith. Dr. Smith is a functional medicine practitioner from Pittsburgh and is the founder and clinic director of Metabolic Solutions in Bethel Park, Pennsylvania. He specializes in the diagnosis and treatment of chronic health problems that are elusive to Western allopathic medical approaches. In our conversation, Dr. Smith was quick to point out that medical doctors are extremely effective at treating acute and emergency issues. But the topic of this episode is food as medicine, and diving deep into ways in which the foods we eat either build our health or drive imbalances that are often the root cause of many difficult, painful, and dangerous chronic health conditions. There are no one-size-fits-all solutions, and Dr. Smith recommends a range of testing to figure out what adjustments each patient likely needs. I especially learned a lot about autoimmune diseases, the different types, what they have in common, and how to eliminate triggers once the disease has set in. Let's get started. Hi, Dr. Smith. How are you doing today?
I'm great, Ramsey. Thank you for having me today.
Yes, absolutely. I'm really glad that you came for this discussion. We're going to talk today about the idea of food as medicine. So basically talking about how eating the right foods can help to correct imbalances while eating the wrong foods can create or worsen problems. But before we dig too much into that, before we get going, love to hear a bit more about you and your background. You are a functional medicine practitioner from Pittsburgh, and you're the founder and clinic director of Metabolic Solutions in Bethel Park, Pennsylvania. So tell me, what kinds of issues do you treat in your clinic, and how do you go about treating them?
Okay, so in my office, I treat a variety of different symptoms and different problems, including hypothyroidism, which is low thyroid, autoimmunity, gut problems that involve things from diarrhea, constipation, abnormal absorption, leaky gut syndrome, abnormal microbiome, things like that. I treat diabetes, brain problems, and helping people with low energy, and a lot of things that are walking in my door right now seem to focus around a lot of thyroid issues. There's a lot of people that have low thyroid symptoms, and they're seeking help because the medical doctors have not treated their problem to their satisfaction.
Yes. All right. Well, let's start here. When we talk about medicine, I think we mostly think about pharmaceuticals. And when you think about the role of pharmaceuticals and Western allopathic medicine in general, what do you think the role of that? Like, what does pharmaceuticals and allopathic medicine, Western medicine, what does it do really well, and what does it not so much?
So, allopathic medicine in this country does a great job at treating acute problems or problems that require a heroic measure to save a life, like a heart attack, a stroke, gunshot wounds, a laceration, a broken bone, things like that. Medical doctors that are trained in the United States are the very best in the world at taking care of those kinds of issues. However, they don't have a good track record when it comes to treating chronic problems, such as high blood pressure or type 2 diabetes or low thyroid disease. What they do is they manage those problems. They don't actually cure them. They don't have a solution for them. So if you go to see your family doctor and you have high blood pressure, that doctor is going to give you medicine to try to bring your pressure down as best as it can. But if you stop taking that drug, guess what's going to happen? It's going to go back up again. So they haven't cured the problem. They just manage it temporarily. Where functional medicine comes in is we ask the question, why? Why do you have high blood pressure? Why do you have gut problems? Why do you have brain problems? What's going on? What's causing this problem? What's the root cause of this issue? So that's really what functional medicine is all about, is looking at or discovering the root cause of the problem and what could be done to try to correct the source of the issue.
So is there maybe an expanded definition of medicine then, sort of beyond, let's say, pharmaceutical drugs?
Well, if you're a medical doctor, then you're going to use pharmaceuticals. That's really what they're trained in. That's their area of expertise. There's all kinds of different ways to fix a healthcare problem. Just like there's more than one way to cook an egg, there's more than one way to fix a healthcare issue. So sometimes it requires you to look at things in a different way. It requires you to look at different types of labs of the problem and try to figure out what's going on behind the scenes. Medical doctors are interested in suppressing symptoms. They're not interested in anything but that. So if you have a certain symptom, they want to treat the symptom. Functional medicine is about looking at the hidden root cause of what's driving that symptom in the first place. So, for example, if it's thyroid disease, the medical doctors don't care what caused the problem. They just want to treat the symptom, usually in the form of a drug, but they don't care what caused the symptom. In my profession, we look at a bunch of different factors that could be causing the problem. For example, if it comes to thyroid disease, the biggest issue in the United States is autoimmunity. And the autoimmune disease that's causing this problem is called Hashimoto's disease. It is so widespread that they've estimated that 90% of everybody that has low thyroid disease has a autoimmune component. The medical doctors don't appreciate this. They don't look for it, they don't test for it, and they don't do anything to treat it. That's 9 out of 10 people that have thyroid problems are going to have an autoimmune component that's going to be causing their symptoms. And so there's also what I call triggers. And triggers are things other than autoimmune disease that can cause this issue. These triggers include anemia, blood sugar problems, such as insulin resistance or type 2 diabetes. It could be due to cortisol issues. That's your stress hormone that regulates your autonomic nervous system. It could be due to sex hormone imbalances. estrogen, progesterone, testosterone. Remember, boys and girls make both, and they have to be in the right amount for the right gender and the right age. It can be due to chronic inflammation and oxidative stress. It can be due to GI problems, GI disturbances, or food allergies or food sensitivities. It can be caused from chemical sensitivities, from anything from solvents to household cleaners that you have in your home that cause problems, or it could be caused from stealth infections. All of these things could be causing low thyroid issues, and none of those things are appreciated by medical doctors. They don't test for them, and so people that go to these doctors, they walk out of the office with their problems either misdiagnosed or undiagnosed, and then they're going to suffer indefinitely as a result of this.
And
So,
how
yeah, go ahead.
and how do you sort of discover and find and sleuth out, if you will, which of these items are causing the conditions that your patients, your clients have?
So when I do a workup, the first thing is I want to gather medical information. I'll look at their past medical history and look at all the different symptoms that they're experiencing. After that, I want to do a consultation and do some questionnaires with them to find out what kind of metabolic imbalances that they are experiencing and what kind of neurological symptoms are they experiencing. At that point, I want to look at order some labs. Now, when I order labs, I order a lot of labs. When you go see a medical doctor, they typically order a very small bandwidth of lab testing. And what they do is done so because of the insurance industry. So by the time you even walk into the primary care physician's office, your treatment plan has been predetermined for you. It's not the doctor that's calling the shots, it's the insurance company. So the doctor's going to order a very narrow bandwidth of tests in order to arrive at a diagnosis in order to prescribe a drug. In other words, he's going to do exactly whatever the insurance company dictates that they will pay for. So yes. In that respect, the medical doctor is not the one driving the ship. It's the insurance company driving the ship. And they don't order enough tests. They don't look at things broadly enough. They look at the very smallest component they possibly can to give them a drug and get them out of their office very, very quickly. And we live in a drug culture, and a lot of people that I've talked to are tired of taking so many pharmaceuticals. I'm not anti-drug. I'm not anti-physician. I believe that there's a time and a place for all healing. There's a time and a place for drug therapy. There's a time and a place for surgeons. There's a time and a place for chiropractors or physical therapists or massage therapists. But I believe that as a people, we're over-medicated. And I think that has to stop.
So if not medication, if not pharmaceutical medication to solve these kinds of issues, what do you look towards instead?
So my approach to correcting problems is by, first of all, identifying what the metabolic issue is, one of those 9 triggers, identifying them, and then removing the triggers. So if it's an issue of, say, gut problems, that's one of the root causes of this. I want to figure out what's wrong with the gut and then correct the gut, either through lifestyle modification or through supplementation. And it's amazing how powerful of a result that you can get just with those 2 things. I mean, everybody is taking acid reflux medicine. If you look at the drug ads that occur right after the dinner hour, they're all for digestive issues. It's not by accident. What is the root cause of it? Is it because you're not making enough stomach acid? Is it not because you're making too much stomach acid? Is it because you're gulping your food? Is it because you're eating the wrong type of food, or maybe there's an allergy somewhere that's been undiagnosed? We want to look at all the different variables and figure out exactly what the root cause is, as opposed to just broadly masking all of the symptoms with a pill.
As soon as you said advertising for heartburn after dinner, I'm just imagining football games where they're advertising pizza and they're advertising heartburn medication probably at the same time or immediately afterwards. So what about food specifically? So is there a powerful connection between what we eat and what we experience in terms of conditions and symptoms? And, what are some relevant examples, if so?
So one of the tests that I order is called a food safe allergy test. And that tells a story about how much reactivity that the person has when they're exposed to certain foods. We're all different. We have different types of chemistries, different backgrounds, different genetics. And one person may have a severe problem to exposure to, say, dairy or grains or meats or certain fruits and vegetables. And by looking at this test, it tells me how big of a reactive response is. So, for example, I ran the test on myself, and I had a high reactivity to dairy and almonds and crab, and that made me feel very sad because I love to eat crab, but apparently it doesn't love me. So,
unrequited love of crab, I feel for you.
So the old way is to do what's called a food elimination diet. And that way you start off with a very bland diet, and then you start to reintroduce certain foods very slowly and very methodically, and then track the response and see if there's things like bloating, gas, distension, abdominal distension, diarrhea or constipation, brain issues like brain fog or nervousness or irritability, things like that. Today, we can do a blood spot test and get the results almost instantaneously to find out what kind of reactivity you have. So there are certain foods. I just had a consultation with a patient about an hour ago, and I went over a test, the test with her. She has a severe dairy reaction. Almost every single dairy product, including goat's milk, she has a sensitivity to. So if you know that you have a problem, all you have to do is find that food and eliminate it from your diet. Just don't eat it, and you're going to feel a lot better. I have a dairy issue, and I didn't know it when it first happened. I was when my kids were very little, I used to take them out for some ice cream, and I would have an ice cream cone with them. And then about an hour later, I was a mess. I was sick as a dog, and I couldn't figure out what was going on with me. And then finally I did this test, and it said that I had a problem with food, with dairy. And I eliminated that. I treated a girl who was 20 years old. For most of her, all of her adult life and into her childhood, she had things like fibromyalgia. She couldn't sleep. She had chronic pain. She was miserable. And like most kids, they eat very poorly. They eat a lot of fast food, a lot of hoagies and all kinds of stuff. And her mother was trying her very best to try to clean up her diet. She was giving her things like grilled chicken breast fillets or green beans and asparagus and garlic. So they came to see me. They'd been to all these medical specialists. They've been to gastroenterologists. They've been to neurology. They've been to pain management. They've been to pediatricians, everybody. And all they did was just throw more and more and more drugs at the problem. So I ran this test, and it turns out that she had a severe reaction to chicken and asparagus and green beans and garlic. So I told her mother, take her off of that immediately. Immediately take her off. She took her off those foods, and overnight, boom, the pain went away. She started sleeping like a baby. The brain fog lifted. She thought I was a miracle. All I did is run that one super cheap test, and it cleared all that stuff out. So food has a profound effect on what is going on in your body. So my process is mostly subtractive than additive. I'm looking to eliminate certain things that you have a problem with. And people are different. There's no one size fits all when it comes to fixing this. The issue is to do some detective work and find out exactly what the hidden root cause is. Food is one thing. It could be caused from liver toxicity. It could be caused from chronic inflammation and oxidative stress or other things. So we have to systematically test for this stuff, and then they're going to feel better.
And then are there ways to sort of think about or discover foods that are beneficial? Certainly there are foods that are widely beneficial, right? Unless you have specific problems with those foods. But, how and what are some foods that are helpful for the issues that you're seeing?
So it's a little bit complicated because there's no one diet that serves everybody the same. One person may benefit from a Mediterranean diet, whereas a different person may benefit from a ketogenic diet or a carnivore diet or an autoimmune paleo diet. So they're going to have different types of reactions. As a general rule, I start people off on an autoimmune paleo diet because it's low sugar, it's low allergen, and it's not going to cause a whole lot of reactivity to your body. It's going to think like lean meats, fruits, and vegetables. Really, really basic things that don't cause a lot of harm and a lot of reaction to too many people. And then from there, we can fine tune it and find out what they're going to respond better to. Like, for example, a person that suffers from type 2 diabetes, they may respond very well to a ketogenic diet, high healthy fats, moderate proteins, very low carbs, or maybe a carnivore diet. Whereas another type of a person may respond very well to a Mediterranean diet. So it's an individual thing, and it has to be approached as an individual basis.
And what about processed foods or ultra processed foods, packaged foods? You mentioned it a little bit in the context of getting fast food and food out. Why is that significant? Why is that important?
In America, there's a lot of people that want to eat McDonald's 6 times a week and then biggie size their Lipitor. That was a joke. But
do they have Lipitor in biggie size? I don't know. Maybe they do.
I don't know. But we eat all kinds of bad things. We don't exercise correctly. We don't manage our stress. We don't manage our nervous system and our posture. And then we start to experience massive symptoms, and then we rely on pharmaceuticals to clean up the mess afterwards. I'm a big believer that if you stick with the fundamentals of wellness and take good care of yourself, get plenty of sleep, make sure you're exercising at least 4 times a week, Make sure you're paying attention to little things like your ergonomics. That's the way that your body interacts with its environment. Maybe flipping and rotating your mattress, making sure that your chair is adjusted properly. Make sure that that you're eating healthy, quality foods in their most raw way possible, as opposed to like heavily processed, deep fried, fatty foods like that. There's a lot of things out there that they don't make it really convenient for people to eat clean. Every time you drive down the street, there's a drive-through, and they typically have ultra processed foods or foods that are not very good for you. And for some people, it's a extra effort to eat clean, but it can be done and it should be done.
I agree. Something that you mentioned, which I wanted to come back to, which I missed the first time around, is Hashimoto's disease. So I think you mentioned that here in America, the vast majority of thyroid issues are caused by Hashimoto's disease. What is that? And talk to us about sort of what that is and why that is such a phenomenon.
So inside the United States, the number one cause of low thyroid issues is Hashimoto's disease. Outside the United States, it's due to an iodine deficiency. We typically don't have an iodine deficiency issue in the United States because we put salt on everything, and it's iodized salt. And so Hashimoto's disease is an autoimmune disease. And the word autoimmunity means that the immune system, which is your defense system of the body, is your white blood cells that go around your body in the circulation, and they kill bacteria, and they remove viruses, and they remove parasites and other types of things that can cause us harm. But every once in a while, that defense system mistakenly starts attacking our own body. Autoimmune means auto means self, and immune means the immune system. So it's a thing where the immune system starts attacking and destroying your own body. There's over 100 different diseases, autoimmune diseases, that have been identified by researchers, and they're all based on what part of the body is being affected. If the immune system is attacking and destroying the thyroid gland, which is a small butterfly-shaped gland in your neck, that's called Hashimoto's. If it is attacking the lung fields, that's called sarcoidosis. If the immune system is attacking the joints in the hands or in your spine, that's called rheumatoid arthritis. If it affects the skin, that's called psoriasis or psoriatic arthritis. It's actually a variant of rheumatoid. If it affects the brain, that's called multiple sclerosis. If it affects the small intestine, that's called Crohn's disease or ulcerative colitis. So there's a lot of different issues, a lot of different body parts that could be affected by the immune system. You cannot cure an immune disease. Once you have it, it's part of your immune system. It's part of your genetic makeup for the rest of your life. There's no turning it off. Anybody that says that they can cure an immune system problem is lying to you. Now, while you cannot cure an autoimmune disease, you can dim it down and put it into remission, so it's no longer causing mischief or destroying your body parts. And that is the very best outcome that you could ever hope for. Autoimmune disease is also very much like a schoolyard bully. If he's picking on kids over here, he's probably also picking on kids in other places. So if you have an area of involvement with autoimmunity, it's very, very likely that you have other areas of involvement, such as the skin, the thyroid, the brain, the gut, and so on and so forth. And so, what I'd look for are what are called triggers that can cause a disruption or an imbalance in the immune system. The immune system in our bodies has, broadly speaking, two main parts. There's the Th1 division, and then there's the Th2 division. The Th1 are like the Marines. They go in there and they kill everything. And then the Th2 is the memory part of the immune system. So, for example, if a kid develops chicken pox, he's not going to be subjected to chicken pox again because the immune system, the Th2 division, kicks in and remembers every bug or germ that he's ever been exposed to, and it kicks it into high gear if he's ever been facing with another clinical dose of this. With autoimmunity, what happens is that instead of balance that occurs between the Th1 and the Th2 divisions, the Th1 becomes dominant and the Th2 becomes recessive, or the Th1 becomes recessive and the Th2 becomes dominant. So there's imbalances that are going on. And that is what causes the problem in the first place. Typically, what we do with this problem is we look at where the source of the problem first starts. And in a lot of people, it starts in the gut. The gut is where the place of absorption happens. When you eat food, the bolus of food passes through the gut, and it's supposed to enter into the bloodstream by way of the enterocytes, the cell walls. If the cell walls start to open up, think of like elevator doors opening, the food particles pass between them directly into the bloodstream. And the body doesn't know what it is. It doesn't know what to make of it, so it starts attacking it. So that sets the stage for autoimmunity. And what happens is that if you eat certain foods that contain gluten, for example, that causes damage to the cell wall and causes leaky gut syndrome. And if you have leaky gut syndrome, you probably also have a leaky brain and you have leaky lung fields. So it can affect multiple places of the body. So what we want to do is we want to test to see if you have a leaky gut and how bad is it and what could be the precipitating factors that cause this problem. That is my way of doing things. The medical doctor's way of doing things is to use what's called an immunosuppressant drug. And you've seen these on TV. They talk about psoriasis, they talk about rheumatoid arthritis, or some other type of autoimmune disease, and they want to use an immunosuppressant drug. That means that they're going to use a drug that's going to suppress your immune system. They can only give you this drug so many times a year because if they exceed that amount, then you're going to be at risk of colds and flus and other types of opportunistic infections. And like if you fix one problem, you create another.
Yeah. So working backwards, we certainly want and we certainly need our immune system to function well. And so, the problem is not necessarily that our immune system is functioning. The problem is that it is attacking the wrong things. And when we look at causality, I think there's two forms of causality that jump to mind. One being what causes a flare-up once you already have it. And another form of causality is what caused the autoimmune situation in the first place. You mentioned that once you have it, you really can't unhave it. Like your body's not going to be completely turned off from having that response. So we've talked a lot about how to not cause flare-ups. What causes these issues in the first place, so that, as folks are going about their lives, uh, an autoimmunity or an autoimmune function might show up? How can we prevent that from showing up in the first place? Is that possible?
So, a lot of researchers have been debating this for a long time. Is it due to genetics? Is it due to the environment? Is it due to toxins? What could precipitate this in the first place? There has been no definitive answer, but a lot of the researchers today feel that this problem is most likely due to a life effect that happens to the person. The birth of babies, the death of a parent, a relocation, a new job, a divorce, some major life effect that causes a change in the body. I don't have a solid answer. I would be not telling the truth if I told you I knew exactly what caused this with everybody. It
Yeah.
remains a mystery. But the current best explanation that I've heard is that it's probably because of a life effect that happened that disrupted the physiology of the person.
That makes sense. I mean, so many things are caused by combinations of factors, right? Things working together. And I think that, I suspect that different people are more susceptible to life events or combinations or exposures in terms of them having a really strong response to it. And so, I guess we can do the best we can do to try to best manage life events or things like that, or to not get exposed. But sometimes that just happens, right? So sometimes we get that, and then it's a matter of dealing with what we find. And just to start sort of wrapping up and summarizing what I'm hearing you say is that, as you recognize conditions of, clients, patients as they come in, you do a lot of testing to discover what sort of the nature of the imbalance is. And then there's ways that you can go through and eliminate those exposures from their diets. And there's ways to supplement and do lifestyle changes to really address those causes of flare-ups and really tamp down the effects that people are experiencing, instead of just trying to, chase and knock down the symptoms one at a time. Is that a fair overview?
That's exactly right. One thing that I left out is the way that I identify these problems is by doing testing that involves a variety of different samples, including blood, urine, stool, and saliva. And so what we do is we take objective measurements. This is not guesswork. We take objective measurements, and then we make our decisions about what we need to do. What kind of supplements does the person need? So, for example, if the person says, I need magnesium, well, how is that determined? How do you know that you need magnesium? Did you test for it, or is it just basically based on what you feel at the time? Do they need a liver detox? Do they need a gut detox? Do they need something to help them to pay attention better? So there's a lot of different ways to fix a problem. The pharmaceuticals are one way, but what I tell people is that if you go to the medical doctors and you try pharmaceuticals and you're still not happy with how you're feeling, then that is the right time to start giving this a try. Doing the same thing over and over and over is one person, and expecting a different outcome is one person's idea of insanity. So the right approach is to try different types of things. So the functional medicine would be ideal for people that they don't feel right. Their hair is falling out in clumps. They have low energy. They have weight gain, even with diet and exercise. They have abnormal skin. Maybe it's too oily or too dry. Or they have low libido. Or if it's a female in the childbearing years and she wants to start a family, but she's infertile, we can sometimes fix that problem. And it all depends on the nature of the issue. But like I said before, the people that come to see me have already gone to the medical doctors. They've already tried the medications, and then they're disappointed with the results. So they want to try something different.
Well, if people do want to find you, if they want to learn more, if they like to connect with you, how do they do that? Where can people find you online?
They can find me at metabolicsolutions.net. That's the best way to get a hold of me. Just go to my website, and you can give me a call. Or if you want to set up a discovery call, that's an informal 10 to 15 minute conversation where we can discuss your challenges. What's going on? What have you already done so far? What are your goals? And what do I think would be the next step for you? So just go to metabolicsolutions.net. Don't go to .com, go to .net.
And do you work with people kind of all over the country, or is it just based locally near your clinic?
No, I can work with anybody as long as we have a phone connection, or if you have an internet connection, we could do a Zoom call. We can work together. So you don't necessarily have to be in the Pittsburgh area. I've worked with people in Texas. I've worked in people in California. I've worked with people in Idaho. So just give me visit my website and we'll go from there.
Terrific. Well, hey, Dr. Smith, I really appreciate your time. I appreciate the education that you gave to me and all of us about these conditions. And I wish you well. Have a great rest of your day.
Thank you, Ramsey. I appreciate it.
Looking for more? Visit what'sworthwhile.net to listen to podcast episodes, learn from books and articles, and live better by choosing healthy products and practices. I'm now offering services through Worthwhile Advisors for personal coaching, professional advising, speaking, and group facilitation. If you or your team are ready to reduce stress and anxiety, build vitality and momentum, and accomplish your goals without burning out, then please contact me, Ramsey Zimmerman, through the website or on social media like Instagram, X, or LinkedIn. Thanks.